Dr. Vladimir Alexeyenko at Restorative Medicine IV Therapy provides infusion therapy and consults patients about IV treatments at his practice in New York City. In this video, Dr. Alexeyenko discusses the cost of IV therapy, insurance coverage for IV treatments, and the different types of IV fluids and the safety of IV vitamin infusions. Learn more about Dr. Alexeyenko and the IV therapy services that he offers at Restorative Medicine IV Therapy by visiting the practice website and calling 917-994-9390 to schedule an appointment for a consultation. How much does IV therapy cost? There are a wide variety of IV therapy services now available at IV clinics across the country. From vitamins and hydration therapy to vitamin therapy for extreme fatigue and weight loss, there are few issues that an IV drip therapy can't address. The real discussion to have is cost versus benefits. Considering the long list of IV treatments now available, what you spend will be determined by the seriousness of the solution that you need. Thousands of people rely on IV treatments to boost their wellness and increase their energy levels with IV nutritional therapy. Because these require basic solutions, they cost far less than the doctor visit you would need to make if you got sick and are therefore a good investment. Glutathione drips, chelation drips, and NAD infusions are more expensive than a vitamin drip. Some IV treatments require a series of infusions over the course of a few months to be effective. Another advantage of investing in IV therapy is that an infusion tends to be less expensive than a full course of pharmaceutical treatment if you get sick. Paying today for an IV treatment that will save you from having to take more expensive medications in the future seems wise. When it comes to IV therapy, the cost is really about whether you want to be preventative when it comes to your health. Whatever you spend on a preventative IV today might save you from expensive hospital stay or a doctor visit later, restoring your energy, boosting your immune system, allowing your body to recover quickly from stress, improving cognitive and organ function. These are the real reasons to consider IV therapy. Does insurance cover IV therapy? Like any kind of treatment, insurance coverage for IV therapies is up to your insurance provider. Most IV clinics don't accept insurance but request that their clients pay out of pocket and submit documentation so their insurance company can reimburse them. This is becoming a common practice even at traditional medical offices. The administrative cost of accepting insurance is prohibitive and reimbursements can sometimes be too low. The hope is that, as more people discover the health and wellness benefits of vitamin IVs, nutrition IVs, and infusions that remove toxins, the more likely it is that insurance plans will value and cover these services. The good news is that IV therapies administered in clinics are a lot less expensive than being in the hospital or having to buy prescription medication. The concept that you can pay a small amount out of pocket to achieve and maintain excellent health while saving on medical costs down the road is appealing to many people. This is one reason that IV clinics are appearing in so many cities and towns across the U.S. For a more serious illness, it might be possible to find an IV provider that will accept your insurance, so it makes sense to do your research. Just be sure that the IV clinic is supervised by a licensed medical doctor who is also an IV specialist. What are the four types of IV fluids? IV fluids have been around for some time but only became widely available in the 1950s. Our bodies are at least 60% water and 2/3 of our fluids are intracellular. This means the fluids pass easily across cell walls and into the cell structure. There are scientific reasons that IVs are efficient. By sending compounds directly into the system at full potency, cells can absorb nutrients and fluids more quickly. Cells regenerate and organs can function more efficiently. Everything from blood circulation and heart function to cell and nerve regeneration can be boosted. The suspension mixtures most commonly used for IV therapy are crystalloids or colloids. Hydration IVs are the most prevalent because feeling tired due to dehydration is a common complaint. You will also see hydration therapy used pre-surgery or when medical practitioners want to help the body recover from extreme vomiting or other conditions that trigger a loss of fluids. The four IV suspension fluids Used most readily are 9% saline, lactated ringer, a compound similar to the body's plasma, 5% dextrose in water, a form of carbohydrate, and 4.5% normal saline. It is necessary to select the right suspension fluid for an IV because these different solutions can impact liver function, heart rate, and other bodily functions differently. Any medical professional will be able to take down your medical history and assess your current condition and determine the right fluid to use. Is IV therapy safe? The idea of getting an IV outside of a hospital setting is somewhat new. However, IV clinics are opening in every major market as the demand grows. It's a straightforward procedure, and drip solutions are compounds we already have in our bodies, but we might not have enough of. This is why IVs don't require FDA approval. Scientific research on IV treatments is underway, with many drips already proving to be effective for boosting energy, metabolism, mental acuity, and for alleviating symptoms of chronic illness. The association that IVs have with serious medical care is outdated. The procedure to get an IV is about the same as a flu shot, it just takes longer. IV solutions are fluids and organic compounds we already have in our bodies. As these solutions enter the bloodstream, unlike supplements or medicines, they bypass the gastric system. This means the treatment isn't diluted by digestion and it won't give you an upset stomach. Another advantage is that IV solutions, as they circulate, they make nutrients and healing fluids 100% available to cells right away. This is rare, cells having all the fluids and nutrients they need to operate at peak efficiency. Organs function better, skin gains elasticity, the digestive system is efficient, even brain cells and nerves regenerate. IVs are also showing promise as a way to treat addiction recovery and to improve mental health, especially treatments of NAD and NAD+.